Regarding all the questions that you guys have, Dr. Sameer Parekh and Roshni, uh, why exactly do we need, why do we need classification? Because generally it's a tendency of human beings to, kind of classify or organize things. Just in any field, not just in medicine, but in any field, human beings have this tendency to kind of organize things, try to categorize things. Let's say, for example, a palette of colors. You will see how they are arranged because we try to categorize. This is a red palette, and all the kinds of pinks and reds and oranges are there. Similarly, in medicine also, we kind of divide and kind of organize them in a structure to simplify it, to kind of understand it better. And kind of it gives us understanding, in treating the patients also, and understanding how the course of illness or how the medical management would be. So observable phenomena and experiences are simplified and then organized. I can give you an example. Let's say, for example, if a person has typhoid fever, you know that the person will have high grade fever, the a person will have, abdominal cramps, there'll be maybe constipation or loose motion or vomiting episodes. So that knowledge helps us differentiate it from another illness, let's say malaria, because in that we'll not have a continuous fever. In malaria there will be chills and rigor. So we kind of divide the whole system and understand it better that way. So that is why classification is generally required. Now, what happens is in psychiatry, we call it psychiatric nosology or psychiatric taxonomy, a process by which complex phenomena then again are reduced, rearranged into categories, and on shared characteristics. Sartorius Norman, he was the he gave this example, he gave this clarification that diagnosis and classification are a means of viewing the world. Why I have quoted him here is because he was a very prominent figure in psychiatry. He was the chief of World Health Organization, the Department of Mental Health also, and he has been president for World Psychiatric Organization for a very long period of time also. So when we talk about classification in psychiatry, we generally don't know what is the causative agent or the source of any kind of mental illness. We cannot pinpoint it. So how do we classify? What we have understood is generally we then group certain symptoms and come to an understanding where we can help them classify by grouping the symptoms, cluster of the symptoms. Now, when we talk about disorders, when we talk about diseases, we talk about syndromes, they sound almost the same, but we don't use terminology like a disease in mental illness. That is because a disease is a very specific entity. It is caused by something which can be pinpoint to a particular pathology in the body, or something like, let's for example say talk about communicable diseases like let's say tuberculosis. So we know that there is a pathology, a microorganism which goes in the body, and then it causes different pathological processes in the lungs, or maybe sometimes other parts of the body, and can then give the symptoms of cough, fever, loss of body weight. But in psychiatry, there is no such as an etiology there. So we kind of classify mental illnesses as disorder. Disorder is something which is not regular, which has created some kind of dysfunction or disruption in the normal function. Mental disorder, then clinically we say significant behavioral or psychological syndrome or pattern that occurs in an individual. So we have to understand it is creating a lot of distress and disability to the person, and kind of we also have to be very careful here, because mental illnesses are associated with increased risk of self-harm and suffering death, pain, disability, important loss of freedom. So the in all the terminology, wherever we talk about illnesses in mental health, be it schizophrenia, be it bipolar illness, be it any kind of stress reaction, everything will be classified as disorder because there is a break in the regular function of the body. Basically, uh, in a general terminology, we generally say like a learning disability is an example of a disorder because a person has difficulty then having school performance is kind of disrupted. There is a problem in his professional life later on, so that is why this becomes an example of a disorder. What is the need for such kind of classification? Generally, what it does is if we classify something in a way that we do, it allows me to communicate it better to another health professional, another psychiatrist. If I say, let's say a person is diagnosed with major depressive disorder, MDD, then just by this line, the other psychiatrist will get to know a lot of information. I might not have to tell him exactly what all symptoms he or she is having, but it'll communicate a lot of information. It will communicate also the kind of prognostic, the course of the illness will be, the kind of treatment the person requires. So this classification helps us communicate better. It also helps me show a patient what exactly he or she is going through, and also help the family members, make them understand what exactly are they suffering from. And when I classify it in a way, then they also get to know that this kind of illness is not unique to them, but it is common. It happens to many other people around us. So it kind of helps us kind of educate the families and the patients. Also, if I give certain diagnosis based on the classification system, it helps me differentiate between the two illnesses. The most common example is like anxiety disorder and depressive disorder. They are very similar when it comes to there is a lot of mixing of the symptoms in these two particular disorders. But if I don't use the term anxiety disorder in a case of depression, the person will we can easily distinguish between the two diagnoses that way. There will be no mix up. I can always say depressive disorder with anxiety symptoms. Then it can make us understand better, or the other psychiatrists or other professionals understand that yes, there are symptoms of other illness also. So these things also later help us as health professionals, as research people, to kind of create inclusion and exclusion criteria for epidemiological studies and research purposes. So a lot of benefits happen based on the classification system. Now, what are the various approaches of classification? We can, like I mentioned earlier, that in mental health, in psychiatry, there is no particular cause, that one particular cause that can create this illness. So that is the etiological versus descriptive that I was talking about. We generally don't follow etiological approach in mental health. We talk about descriptive system. The descriptive system is based on clinical descriptions of the presenting symptoms. So it is generally proved of a greater utility, and because etiology can be the mental illnesses generally have multifactorial issues. It cannot be pinpointed to one particular issue in the brain which is causing the disorder. Now, another approach is syndrome versus symptom. Generally, syndrome is a cluster of the symptoms which are very particular in the particular system, particular syndrome. Like symptoms are varied, and in psychiatry there are probably thousands of symptoms. We cannot call a symptom a disorder, because in that case the list will be endless. So what we have understood in psychiatry is the symptoms, various symptoms, they come together in cluster and then form a syndrome. Syndrome makes it easier again to kind of classify. So we follow descriptive way, we follow syndromal way, and then the third is categorical versus dimensional. Now, the categorical approach is where it involves the assessment of whether the individual has a disorder on the basis of symptoms and characteristic that is typical of the disorder. Again, it sounds very much like syndrome, but here the clinical picture is taken into account, and uh, and all the symptoms have been put together. There is no in between here. There is no that you either have schizophrenia or you don't have schizophrenia. There's nothing in between. So we develop certain parameters in categorical approach where these all are the various diagnostic criterias, and amongst these, if a patient shows, let's say, 5 or 6 of the diagnostic criteria, then we can say it is schizophrenia. But if a person is just having one of the symptoms, then we cannot call it as a schizophrenia. I'm just trying to give it as an example form. So categorical form is very widely used in all the classification systems across the world. We'll come to the various classification systems like ICD and DSM. So categorical system also basically is like I mentioned, it is not regarded to the etiology. It is intended to be atheoretical. That means we cannot give any kind of etiology. We just describe this symptoms and then cluster of symptoms, and then we accordingly classify the illness, the disorder in that particular category. Now, there's a difference between the categorical and dimensional. Dimensional is something which talks about the severity of the illness, like say from being mild to being very severe. So dimensional approach is generally is not utilized in all the disorders, but in the ICD-10 and DSM-5, now dimensional approach is also gaining a bit of importance. Again, it helps the clinician, it helps the psychiatrist understand the illness better. Again, it's about the prognosis, the treatment, the course of illness. So that information we get better from dimensional approach also. But the classification system specifically remains more categorical. So we are using descriptive, syndromal, and categorical approaches in classifying the various mental illnesses. So DSM-5 gives a definition of mental disorder. I'll just go through this so that you get a better idea of what we are calling as mental disorder. A mental disorder is a syndrome characterized by clinical significant disturbance in an individual's cognition, emotional regulation, or behavior. Now, cognition are the thought processes, what goes on inside the thought processes. Cognition also includes memory, intelligence. Then comes the emotional regulation, how we are reacting to the particular situation, what emotions are, taking over our particular in that particular time, and the behavior, what is the outcome of the thought processes, what is the outcome of the emotional